Declaring a major incident provides the government with greater flexibility on how to deploy public sector personnel and resources. The Chief Minister will give more details in due course, but GBC understands that it could mean that key GHA staff are on call 24/7 and could be redeployed to other departments as required. A bronze, silver and gold command structure is being implemented. This is likely to be the first time a major incident is declared on the Rock, giving some indication of the challenges facing the public sector and, in particular, healthcare workers in the coming days and weeks. The Director of Public Health, Dr. Sohail Bhatti, has previously said that as few as 20% of people contracting COVID-19 would experience symptoms, and only a fraction of these are likely to require help in hospital. But as the total number of cases increases, so does the likelihood of some of them requiring medical care at St. Bernard's Hospital. The GHA has now effectively put itself on a heightened state of readiness in anticipation of what its professionals are calling the surge. At Saturday's press conference, the Minister for Public Health, John Cortes, did not elaborate further, but in reply to GBC questions, he said additional resources will always be welcome in order to cope with what's expected to be a significant additional demand on the health service.
Apart from the space that we have made available, the number of beds available, and the staff that we have brought over from the UK, as has already been said, we have asked the military for support, and they are also providing the resources, including the human resources that they have here in Gibraltar. And there are a number of volunteers being trained. So we feel we are in a position. We could always do with more. If there are still nurses and doctors out there who haven't volunteered, then obviously we'd be very happy to take them on. And we are still looking in the UK for other people who may be wanting to come over, including, for example, medical students. So we are confident that we are in the right position, but obviously every bit helps.
Infection numbers are on the increase. There are now 56 confirmed cases locally, 42 of which are active. The trend is for around 30% of tests to come back positive. And with 220 pending tests, Dr. Cortes is expecting Gibraltar's tally for confirmed cases to go up by at least another 50 shortly. Following Friday's news that 2 health workers from Mount Alvernia had tested positive for COVID-19, Elderly Residential Services Manager Susan Vallejo has assured relatives of residents in the home that measures are being taken to prevent cross-contamination at all ERS sites.
I can assure you that we are screening and monitoring all our staff, and includes everybody from domestics to the last labourer coming in. We were there from 6 o'clock in the morning, taking temperatures and questioning our staff. Any symptoms, they do not come into the building. Unfortunately, the symptoms, some of them might have it and they're symptomatic, and those are the ones that may be. But I can assure you that everybody is screened, including myself. Doctors and everybody is screened. I can also tell you that we've increased the cleaning and disinfection, and this is not from now, this has been going on for the past 3 months since we heard about the COVID. So we've got 24-hour cleaning and disinfection from every single facility, not only from Mount Alvernia, that includes Hillside and John Cochrane, Carpe, and John McQueen, and the Jewish Home. So everything is included. Everything that we do in Mount Alvernia, this is mirrored by all other sites in the ERS.
With the government preparing for all eventualities, and as with many other countries, the prospects being fairly grim, the Minister for Public Health referred to works being carried out at North Front Cemetery, where 200 niches are currently under construction. He said the additional burial spaces are in anticipation of a greater number of deaths than normal in the next few weeks. Dr. Cortes was unapologetic for the sombre tone. He hoped the draconian steps being taken are working, while at the same time warning that what's being seen elsewhere is coming to Gibraltar.
Last week I said we were expecting positives to rise significantly, and they have. Today I have to say that based on virtually every other country, we can expect a surge in hospital admissions, including those needing intensive care. and we can expect deaths in the vulnerable groups, especially the over 70s, within the next few weeks. If this once again sounds somber, I cannot apologize. It is my duty as Minister for Public Health to tell you as it is and on the advice I receive from the professionals. We can improve the outcome and we can beat it, but you must follow advice.
The message was clear. Lockdown means lockdown, and maintaining distance and avoiding contact at all costs is vital. Dr. Cortés said, "We are all in danger, and we mustn't forget that."